If you're searching for the fountain of youth, but you aren't willing to go under the knife to get rid of those wrinkles, we've got news for you. There's non-surgical options available to Canadians looking to reverse the effects of time. It's called Thermage, a procedure performed with an advanced radiofrequency device and requires no incisions or recovery time. Here now is a closer look.
I'm going to be 49 next month. It's been a pretty tough year. My mom has been in the hospital for the last 3 months. She's getting out, so that's great news. But, you know, just kind of a lot of late nights and not taking very good care of myself. And I just think, you know, for the most part, I've felt, you know, like pretty young. And I just feel like I'm not looking so young anymore. And I just like a little freshen up.
Now, what brings you in today? What can I do for you?
I would like to get some of the pigmentation in my skin look clarified. And I also find that my skin is drooping over the last little while, so if there's anything, I've heard of Thermage, and I've heard that that can help with that. And I've also got tons of fine lines.
What I'm going to talk to you about are basically non-surgical things, okay? Because if you want something like surgery done, which can't really address everything that you've just mentioned, then we would refer you to a plastic surgeon. But let's talk about what me as a dermatologist can do for you.
Okay.
So when I look at your skin here, I see a lot of sun damage. There's lots of brown, little freckly areas. Mm-hmm. We see some lines here and some lines on the bottom and some grooves, and they're different. What you have on the top is what we call dynamic lines, and those are caused by your muscles contracting. And what we see on the bottom are lines caused by aging and by the fact that your skin is starting to shrink. The cheeks, which have normally a nice fat pad, are deflating and they're starting to fall, and that's why you're seeing the sagging. So the first thing that you mentioned was that Thermage. Mm-hmm. And that's a way to tighten skin. Okay, so I'm just going to put a drop in. Just going to let that take effect. So we freeze the surface of your eye with some drops, and then I just gently place this contact lens on your eye. It's a plastic contact lens, and it covers your entire eyeball, and it keeps your eyeball safe. Just open your eyes now. Okay, perfect. So we have the eye shield in place. We're going to start the Thermage procedure now. Okay. We're going to put a little paper on, which will put a little temporary tattoo with little squares on your eyelid. And this is the grid pattern. It helps us to do the Thermage accurately. So we're putting a little gel on your skin. What it is a little handpiece which sits on your skin, and we just pass it over. And it delivers what we call RF energy, which is like radio waves. Okay. But what it does is it heats up the skin, not the top of the skin, but the deeper part of the skin. And it heats it up to a point where the collagen fibers, which are protein fibers that the skin is made of, it tightens them up, causes them to tighten, and stimulates the cells to produce more collagen. And one of the problems we have with aging is that our skin produces less collagen, and our skin degrades in quality. So this is going to stimulate your cells to produce a skin which has better quality and tighten up your skin. And if we do Thermage here all over your face, and on your forehead, and on your eyelids, it's actually going to lift and take away the loose skin on your eyelids, the little bags that are on the top part of your eyelids. That's going to also improve. Afterwards, there'll be a little bit of redness, there'll be a little bit of swelling, and that'll be it. Tomorrow you'll be able to go back to your normal activities. Now, as far as the brown spots on your face, there we can do Fraxel treatment. We can do the two procedures in one day, one after the other. We do the Thermage first, and then we do the Fraxel second. Okay, and I'm going to put on my laser eye goggles, and we're ready to go. And Fraxel is going to work on the surface of your skin. And what it does is it helps to resurface your skin. So it's as if we sort of take off the top layer and put a fresh new layer on top. And what it does is it takes off little bits, little circles of skin, but it leaves spaces in between of normal skin. It's almost like a cookie cutter. So that'll take a few treatments, and that Fraxel is going to help to make your skin smoother. It's going to take away some fine lines, and especially it's going to work on those brown spots.
Okay, your Fraxel treatment is finished.
Great.
Your skin is a little red. You'll peel for a couple of days.
But what you'll see is a little bit of tightening initially, right after the treatment, but then it takes about 6 months to see the final tightening and the final production of new collagen.
Now we want to introduce you to the patient that you just met in our story. Lynn's here, and let's see the before and the after. Well, look at that. Stay tuned, because when we come back, we're going to learn even more about this procedure. Are there any risks? Is this something that's right for you? And how is Lynn enjoying her new look? Stay with us. We'll be right back. Welcome back. I'm joined now by Dr. Fred Weksberg, the medical director of the Weksberg Center for Cosmetic Dermatology, and Lynn Wild, a patient of Dr. Weksberg's. Before the break, we introduced you to Lynn. She recently underwent a combined treatment known as Thermage and Fraxel. We want to let Canadians know more about this treatment, so Lynn, I'm going to begin with you. Firstly, thank you for coming.
Oh, thank you. My pleasure.
So let's look at the remarkable before and the after and see that difference.
Okay.
Do you see the difference?
Yes, I can definitely see a difference.
And tell me about what happened immediately after the procedure.
Immediately after, my face was pretty red. There didn't seem to be a lot of change. Obviously, there was a bit of swelling.
Yeah.
Not very much bruising or anything like that, though. And then a couple of days went by, and then I started to peel. And that was crazy because it was just like it brings all the stuff to the surface of your skin. So before it falls off, you kind of see it all. You know, like I saw a scar from falling off my bike 5 years ago, like that kind of thing.
You could see your life flash before you through your skin.
Yeah, it was really good. And then that fell off. There was peeling. The peeling lasted, I think, for probably about a week and a half.
Yeah.
And then my skin just looked so much clearer.
So, Fred, this procedure has some immediate benefit, but it also gets better over time. Why is that?
Well, what we did that day, the first day, was that we did two procedures. We did the Thermage procedure and we did the Fraxel procedure at the same time. So we first started with the Thermage. What that is a procedure which heats up the deeper layers of the skin, causes skin tightening.
Right.
So it helps to take away wrinkles and lift and tighten, but it takes about 6 months to see the final result. So at this point, we're at about 7 weeks. So we see some skin tightening, but that's still going to improve a lot. And right after that procedure was done, immediately we went on to do the Fraxel procedure. Now that procedure is a laser which basically takes off the top layers of the discolored skin, aged skin, and helps improve pores, takes away all those little brown spots that you start seeing with sun exposure and with aging. And that starts to peel off after a number of days. So initially you don't see it. After about day 3, you start to see this peeling, and it really starts to peel. And you see all this dead brown skin peeling off, all those brown spots.
What was the most surprising change when you look? I mean, I definitely see differences when I look at you before and after, but for you, you know, when you look, what are the big changes that you see?
I think definitely the clarity of my skin. And I think that the fillers, like in here, made a big difference.
So who would you recommend this to? You know, is this something that you would endorse? Are you happy with the
Oh my
results?
God, yes, definitely. Yes. I'm sure that Dr. Weksberg is going to have lots of calls from my friends.
So when you're choosing someone, you know, someone comes to see you to talk about what they want to do, you know, what are the things that would make you say, no, you're not a candidate versus yes, you are a candidate?
Well, generally you need to have somebody that's healthy. If you have somebody who has medical issues, you have to be careful about what you're going to do if they're on certain medications, diabetics. But most patients can do these type of procedures. Unless they're keloid formers, then you can't do laser treatments on them.
Now, how long will this result last? Like, how long the improvement in skin do you expect to see?
The Thermage part of the procedure, the skin tightening procedure, is going to be permanent. Now, her skin is going to become more loose as she's going to get older. That's going to be years down the road.
But that's true for all of us, isn't it?
Okay, of course. And the Thermage can be repeated. The other part of the procedure, again, is going to depend on how much sun she's going to have.
Right.
If she's in the sun a lot, she's going to start getting brown spots again. And she can do the Fraxel part of the procedure again as well, because you don't get rid of every single brown spot with the procedure, but you get through a large portion of them. So you can have it done again if she wants. Doesn't have to have the combined procedure.
Right.
So,
well, we have to ask you the question that everybody out there is wondering.
Yes.
So we've had, you know, cosmetic surgeons and plastic surgeons on the show talk about facelifts that start anywhere between $30,000 and higher. So what is it like in terms of cost? Certainly the downtime and the fact that there's no surgical risk is a big plus here. But what does it come out for dollars and cents?
okay. For the Thermage, generally, full face Thermage, including the eyes, it's about $3,000. For Fraxel, it's about $875. Per treatment, so she might want 2.
Right.
In her case, we did some Botox injections for her in the neighborhood of around $600.
So bottom line is that, you know, compared to a facelift, there's a huge difference in affordability.
Huge difference, and there could be such a tremendous difference in the appearance of the skin.
But it's still expensive.
It's still expensive, but facelift procedures very often require these type of procedures as well. They very often need to get rid of the brown spots. Facelift doesn't address that.
Well, it's great that there are these non-surgical options, and there seems to be so many more. Overall, how long was your downtime, the time where you felt that you didn't want to leave the house? Was there downtime?
I can't say that there really was any time where I felt like I couldn't leave the house.
Well, I want to thank you both for being here. Lynn, thank you for sharing your story with us.
you.
We've got this wonderful before and after, and you look terrific.
Thank you.
Thank you both.